Thanks for such a great audience today, a big group. I have a mic on. I think you can hear me. It's okay? Back in the back? Good. So I'll try to work through this. I have a lot of material, and 40 minutes I might feel a little bit rushed for time, so I'm just going to go ahead and start and try to summarize some of the work that we've done to investigate relationships between public health and mountaintop mining, and investigations about the role that environmental contributions might play in those types of relationships. I'm hitting this and nothing happens. There, okay. Many of you probably already know something about the practice, but just as a very quick summary, mountaintop removal mining is a form of large-scale surface mining. It's practiced in areas of central Appalachia, in parts of Kentucky, West Virginia, Tennessee, and Western Virginia. It involves the use of explosives and heavy machinery to remove large volumes of rock and soil above coal seams. It deposits the resulting overburden or spoil into adjacent valleys. As early as 1992, the EPA had estimated that 1,200 miles of streams had been permanently buried in Appalachia from this practice that's higher now. This soil the practice takes place on ridges in Appalachia that tends to occur in close proximity to places where people live. So this photograph, for example, shows a close proximity between a small community and one of the mining sites. It occurs above where people live, and there are reports about concerns that people had about possible water quality problems or air quality problems related to this form of mining. So when I moved to West Virginia, I hadn't investigated that type of a topic before, but I became interested in it. I started to look at whether or not there was evidence that might support those concerns. And I didn't have a particular dog in the hunt, so to speak. I didn't have a stake in what I would find when I started one way or the other. But as I did more and more and the evidence has accumulated, I do believe that there's a legitimate issue here, that the people that live in these communities do experience public health problems that are partly the result of other types of socioeconomic disadvantages, things like smoking rates and high obesity rates and living in poverty. Many people in these communities do. But there's something beyond that. It's not just that. There's something that I think is related to the environmental activities of the industry. So I'll show you what we've done so far and kind of where we're at and what we're still trying to do, what we don't know as well as we would like to at this point. So this work, I'm going to divide it quickly into two main kind of phases. An initial phase that describes some of the early evidence, and then moving into a later phase with some of the more recent findings that we've done. And it started with resident accounts. It started with talking to people who lived in these communities and learning about their experiences. Before I did the first study, I spent quite a lot of time driving around in southern West Virginia and trying to meet people and talk to them about what they thought they were experiencing that was related to this mining activity. So here's an example of one of those resident accounts. They use explosives at these mining sites commonly, and there are common reports about the dust and the particulate matter from these sites coming into communities where people live. And here's a sequence of photographs, not high quality photos, but it shows an explosion in the town of Dorothy at a mining site right there. And the dust coming down the hillside, but this hill is still visible, and then here the hill is obscured as the dust from this blast has entered the town. This is a kind of an activity that takes place commonly in some of these communities. Another example of a sequence of photographs showing dust from an initial explosion and how it traveled and eventually can reach places where people live. This photograph was taken in Sylvester, West Virginia, just a few blocks away from a large coal processing plant. This lady lives in Sylvester, and she's gone out to her back porch and taken a damp paper towel and wiped off the top of her barbecue grill cover, and she showed me this black towel. And I took that photograph and I went back a few weeks later, 2 weeks later, and she did it again and she showed me another towel that was just as black. The material accumulates quickly from the activities at this site. This, by the way, was the site in Sylvester that was at that time covered with a protective dome that was designed to reduce the levels of dust in the air. I don't want to install the update. In addition to air quality problems, people would report water quality problems. Certainly some cases, it's hard to know how extensive or widespread it is, but some cases where people's private well waters have been contaminated with slurry from coal mining activities. I have two photographs here to give you a sense of the time frame, that this was a problem that existed in this town for several years before the town was finally provided with public water. And if it looks like that, you're not going to use it, probably. But sometimes it doesn't look that bad. Sometimes it looks relatively better. Even if you wouldn't drink it, maybe you'd be tempted to use it for washing, for cooking. It's hard to know. But there's some cases where people's well water has been impaired, but the extent to which that may have been a larger population or public health problem, at the time, we didn't know. We didn't have information on that. So we started with some studies of secondary mortality data. We would go to places like the CDC that reports age-adjusted mortality rates, and we started to look at what was easier, what was practical to do without, I didn't have a big NIH grant to do this kind of work. I was just trying to get started with some things that I had the time and the resources to do. So, and we started to find these relationships. We would find, for example, that there was evidence that higher levels of coal mining in the Appalachian region was associated with higher total mortality rates, lung cancer mortality, and forms of heart, lung, and kidney disease. The effects become stronger as the amounts of mining increase. So the health problems are the most severe where mining is the heaviest. They are intermediate where mining is intermediate, and they are best where mining is absent. They're present for males and females, and we controlled for other covariates. We controlled for things like smoking rates in these communities and obesity rates and other types of covariates. And we still saw this additional effect that seems to be dose dependent. And we found when we looked beyond mortality at some morbidity indicators that a very similar pattern emerged. Higher rates of chronic cardiovascular, respiratory, and kidney disease, heart attack and coronary heart disease, more poor health and activity limitations. These earlier studies at that time had not yet identified mountaintop removal as a specific form of mining, because when we started, we weren't quite sure how to do that, how to identify where mountaintop removal was taking place versus other forms of mining, surface mining. And so the way that we operationalized the mining variable was usually based on something like the tons of coal that were mined at particular sites, and try to use that as an indicator. In this study, this is to me one of the most interesting early studies that we did, and maybe potentially one of the most important. What we did was to track those excess age-adjusted deaths over time. At the point that we did this, the data that we had covered a period of time from 1979 to 2005. We estimated the excess number of annual deaths based on the size of the population that occurred over that period of time. And there's an estimate that goes from a lower end to a higher end, so it's a range of estimates depending upon what group you use as the comparison. The biggest estimate if you compare the national rates over a more recent time period. And it does seem like if there are mining effects related to mountaintop removal, we have some evidence that those effects have become more pronounced in more recent years, potentially as the impacts of that practice have accumulated. And then we did something where we estimated something called a VSL, which is a value of statistical life. And that's an accepted practice in many federal agencies to do that. If you're going to make important policy decisions about how to invest in one area or another, you want to be able to estimate the cost of that investment versus its benefits in reducing premature mortality or improving health. So federal agencies are often required to incorporate these VSL estimates in their estimates. So we use some published versions, a higher and a lower estimate, $4.67 million to $7.74 million per life. Multiplied that by the excess number and came up with these estimates of the cost of premature mortality associated with coal mining in the Appalachian region. The lowest estimate is $18.5 billion. The highest one is over $84 billion. Those are in billions. There was an independent assessment done by some economists here at the University of Kentucky a while back that tried to estimate the benefits in terms of the direct, indirect, induced benefits of the coal mining industry in Appalachia related to the jobs that were created. And their own estimate, which was not a pro or anti-coal estimate as best that I could tell, it seemed balanced. Their estimate of the benefits of the mining industry to Appalachia at that time was a little bit more than $8 billion. So even the most conservative estimate of the cost is more than twice as high as the estimated benefits of the industry. This is a very early first attempt that we made to start to look at environmental conditions. I worked with Than Pitt, who's a USGS scientist on this, and he had a measure of stream integrity, which is the biological health of streams that you can measure using some accepted practices. And we found that mining was related to lower stream integrity, to poorer quality streams, and in turn that stream integrity was related to higher human total cancer mortality rates. So this is one of the kind of the summary papers that started to come out after the early first stage of that evidence. And I feel pretty fortunate to have been able to work with people like Margaret Palmer and Emily Bernhardt and others in writing this paper that was published in Science called Mountaintop Mining Consequences, in which we presented some new evidence as well as reviewed existing evidence, and did something that's pretty unusual for a paper in a scientific journal, which was to call for an end to mountaintop removal because of the evidence that it cannot be done within the law, within the existing law, the Clean Water Act. Reclamation efforts that are supposed to be done routinely fail. Streams are not recreated as they're supposed to be. Downstream water quality is impaired. This is aside from any potential health impacts, in addition to the potential health impacts. So this paper came out and has been frequently cited in the literature now for recommending that mountaintop removal be terminated because of its negative effects. So, more recently, moving on now to phase 2. I see I got through phase 1 pretty quickly, so maybe I can slow down a little. I tend to get talking really fast sometimes. More recent steps and observations. We started to focus on mountaintop removal specifically. We went back and more or less replicated some of the earlier studies that we had done with a different measure based on what we thought was mountaintop removal specifically. And we found that the health disparities that we had identified earlier are concentrated in those areas where mountaintop removal takes place. We identified those areas based on satellite imagery that's been developed and some definitions of the footprint of the mining site that goes over ridgetops of certain sizes. And we found that mountaintop removal specifically was related to higher levels of cardiovascular mortality, cancer mortality, and to poor self-rated health and activity limitations. So that's another example of going back to some of the secondary data that we analyzed. And then for the first time, we started to do some primary data collection in communities to try to understand better what people were saying about their own health when they lived close to those mining sites or farther away from them. And started also to do some environmental sampling, I'll show you some findings for. And another lesson that I've learned is that political change is slow, and we'll talk a little bit about that as well. So here's one of the secondary studies that we went back and kind of re-examined. Total mortality rates per 100,000. This is looking at a county level analysis, so it's an ecological design, and of course many of you epidemiologists and others know that that's a limited design. It's hard to make confident causal statements with something like this. It's one piece of evidence. But what we did over this period of time was to divide the counties in the 4 states where MTR exists. Sometimes I call it MTM, I know this, sometimes MTR, mountaintop removal or mountaintop mining. So it's only the counties in Kentucky, West Virginia, Virginia, and Tennessee, and divides those counties into 3 groups: those that have some level of mountaintop mining, those that in Appalachia without that mining, and the other counties in the state. And you'll see that the levels obviously in the MTM area are much higher. This is only age adjusted, but you can adjust for other risk factors, and the disparity, the significant disparity in the mining areas persists. And we also know that the Appalachian region has been infamous for the health disparities that have existed here for long periods of time. And some of what we found shows that if you go outside that area where mountaintop mining is practiced and look at the rest of the region, for those 2 other lines, for the most part, are not different from each other. that there is no Appalachian disparity, except in the areas where mountaintop mining is practiced. And I noticed, can I go backward on this somehow? Oh. You'll notice that the time period for this one is 2000 to 2006, which is a pretty narrow time period. And I was looking at this as I was getting ready for my talk here today and curious about what a longer time period might show. So I went back to some of that CDC data and kind of re-examined it again, realized that it'd been a while since I'd looked at it. I've been moving on to other kinds of things. And this was, at the time, this 2006 data was the most current that was available. Now we have data up to 2014, and the CDC has added older data as well. So now there's available from the CDC a longer time period that goes all the way from 1968 to 2014. And I kind of repeated those three groups. So this is the same 4 states, the same county groupings. And it shows just over a longer period of time what those mortality trends look like. The left graph shows the age-adjusted mortality rates over time. There's a number of things to this picture that are interesting to me. One of them is that the age-adjusted mortality rates in the MTR counties have been higher throughout the time period, even as early as the late 60s. Mountaintop mining didn't really get started on a large scale until the 90s. So there was a disparity that was present even before mining started. And that may be due to other forms of mining that were taking place. It may be due to other socioeconomic differences. But you see that it was higher. You see that there's a decline over time in all 3 of the groups over the first part of that period, which is consistent with national trends of overall declines in mortality rates. Then you see that the scale for the mountaintop removal area flattens. The line flattens right about here and doesn't really change much for quite a while. Here it's changing a little, but not very much. It's almost flat here too. And then right about there, it looks like it's diverging again. At least that's my kind of subjective interpretation of it. And then what I did was I took those same pictures and I converted it to differences. So the second one on the right shows the difference in the age-adjusted mortality rates between the MTR areas and other Appalachia is the blue lines, and the difference between the MTR areas and the rest of the states in the red line. And you can see the pattern here a little bit more clearly, I think. Over the first period of this time, the lines are kind of crossing each other and they're not going up very much. And here, right about here, they start to split and the slope changes. It's going up at a faster rate. You can pick it up more readily. So one of the things that was interesting to me was realizing that in 1990, there were revisions that were made to the Clean Air Act to try to promote the use of, to try to reduce acid rain and other pollution coming from coal-fired power plants. And one of the consequences of that was that low sulfur coal, such as we have in central Appalachia, suddenly became more attractive. And that was one of the driving forces in the emergence of mountaintop removal in the 90s, was this more attractive use of this coal. And so I did an analysis, a panel design analysis. I don't have the results here. I'm actually working on it now. So I have this meeting to thank you for helping me develop this new paper. This is not published yet or anything. I'm still working on it. But I did a panel analysis where I looked at changes over time and looked at the pre-post differences based on that 1990 split. And you can do an interaction of the mountaintop removal group times the Clean Air Act times the year and control for year effects. There's a strong, significant effect where you see higher mortality post-Clean Air Act in the mountaintop removal mining areas. Which is kind of an unintended, potentially negative consequence of the Clean Air Act. It wasn't intended to do that, but sometimes these policies that are intended to have certain benefits unexpectedly will have other consequences as well. This is an example from one of the community health surveys that we did. We did a series of these over a number of years, and the first one we did, we only asked questions about people's own health, and we asked questions about more formal kinds of diagnoses that people may have received from physicians using some CDC items. And we got some feedback from some of our community partners, and they said, you know, that's all well and good, but a lot of times people have trouble accessing doctors. They may not have formal diagnoses, even if they're suffering from some health problems. And you also ought to talk about other people in the household, not just the person who answers the door to complete the survey. Because somebody can't answer a survey if they're already dead. I mean, that's the kind of feedback that we got. And we would say there's a lot of cancer in these communities. A lot of people have died. You can't just ask people who can answer the door and are healthy enough to answer a survey. So we made a couple of changes to the surveys. We started asking about symptoms as opposed to formal diagnoses. And we started asking about household illness as well. So this chart shows some prevalence ratios, individual level data, person level data, controlling for age, sex, education, smoking, obesity, other variables. And we found we had this checklist of 28 items or so that asked about symptoms in a variety of different areas. And we found that the people that lived in the mining communities versus the control communities reported significantly greater risk of these symptoms for all kinds, all types. This other one is pretty high. It's dominated primarily by one item asking about fatigue, and then the respiratory symptoms comes out as being relatively high as well. This chart is kind of crude and hard to see, and there's a lot going on. But this is one of from the same study, showing the prevalence ratios, again, controlling for other factors. And the black bars show the effects for the mountaintop mining area. The point estimates are the same as the previous graph. I don't have the error bars, but the points are the same. And what we did here was we were curious to compare what are the size of these prevalence ratios compared to kind of the standard risk indicators that we look at. So we looked at what are the comparable prevalence ratios for smoking and obesity. And you can see for the respiratory symptoms, as you might expect, people who said they smoked, really high respiratory symptoms. Okay, that makes sense. But for all of these other types of conditions, the risk associated with living in a mountaintop mining community was as high or sometimes higher than the risk associated with smoking or obesity. Same study asking about household illness, this time looking at two indicators: serious household illness. Has anyone in your household had a serious illness within the last year? Or household cancer death. Has anyone in your household died from cancer in the last 5 years? And we see that the rates are significantly elevated for the mountaintop removal communities, and there's the smoking and obesity indicators again as a comparison. This is kind of just a repeat. It's a more recent survey finding really similar things. I wanted to show this one just to kind of re-emphasize the importance of the respiratory symptoms. It's what we've seen coming through pretty clearly time and again, that I think is partly related to the environmental consequences of mountaintop mining and the air quality issues that it raises. So this again controls for smoking, at least self-reported smoking and other variables, and shows that people that live in the mining community have a higher number of respiratory symptoms and are more likely to report a COPD diagnosis. So it's right about this time that I put my depression scale in, because everybody's depressed by now. Hearing all of this evidence and hearing these studies. So we looked at Bertha survey data from the CDC, got a score of high depression risk from that, and examine the difference between the risk for depression, or at least high probability of depression, high depressive symptoms, in the MTR communities. And again, higher odds ratio, higher risk for depression, controlling for covariates. I think you can probably appreciate that if you've lived in these communities or you've seen the job opportunities are in decline. There aren't that kind of jobs that there used to be. There's not yet a serious effort to replace the loss of this industry that's coming. The roads are being damaged, the mountains are being destroyed, people can't go to the places where they used to go. It's not surprising to me that you would have these kinds of effects for people that are living in these environments. We did a study on birth defects. This is another secondary data analysis, but it analyzed, I think it was 2 million, if I can remember correctly off the top of my head. It was several million birth records. Looking at the same 4 counties, same 4 states, and showing that if you adjust for not only age, but the bottom row is adjusting for mothers who reported that they smoked during pregnancy, or that they had other medical conditions, controlling for age, controlling for health insurance variables, that the women who were pregnant who lived in a mountaintop mining area during the time that they were pregnant were more likely to report a birth defect compared to these other groups. Same study on birth defects. This time it breaks the numbers down in some more fine ways. It's broken down both by the type of birth defect in the rows and also by the time period. At this time, this was the whole time period that we had to work with, where we could identify the county where the mother lived. And we divided it into an earlier and a later period, again with the idea that if there's a mining effect, then maybe that effect should be more pronounced in the more recent period as the impact of this practice has extended. And we found that in some of these types of cases. So the circulatory respiratory conditions, for example, show a big change from the earlier period to the later period, heart defects in babies. And the changes were present in several of these other conditions as well. Oh, and I should say that effect 2.81 for birth defects, we were also curious about how that compared to the smoking effect. So for mothers who reported, and they may underreport, so it's not totally objective, but mothers who reported that they smoked during pregnancy, the risk was significant, but it was about 1.3 compared to 2.8 for living in the mountaintop mining area. So we conducted a large number of these studies using secondary data, some primary data. We see this really, to me, this compelling pattern where it's not just a correlation between mining and health, but it's a pattern that's dose dependent based on the level of the mining. It's a pattern where you see stronger effects specifically in the mountaintop removal areas. It's a pattern where we see similar kinds of effects in relationship to disease for morbidity and mortality indicators. It's present for women, not just men. If it was a direct result of occupational exposure, you would expect to see the results would be stronger in men. It's not. And it's present for some children's outcomes. So that prompted us to start to do some environmental sampling. We have this strong pattern, but still, everything that I've shown you so far, I haven't shown you any environmental data. We're thinking maybe there's an environmental contribution, but we don't know. We're just seeing this pattern and we're concerned. So we started to look at some environmental data. I worked with some, and it was important for me then to partner with others who had the background and the training in these areas, because it was relatively new from my background to do this kind of work. So I partnered with some people from West Virginia University, some environmental health scientists, some scientists from the USGS, who did some really important data collection field work for us. And we started to collect air samples, water samples, in these towns where people live. There have been some studies before that have looked at water quality impacts from mining, published primarily by some great scientists at Duke. And they've clearly shown that mountaintop removal impairs water quality for prolonged periods of time, even decades after mining stops at a site. But that was out in the woods, basically, right? It's surface streams that they're collecting samples from. It's not where people live. We went into communities. We set up air monitors in people's backyards, on their porches. We started collecting water samples from their wells and started to see what we could learn about the conditions here. So one of the things that we did was we got these air samples using these low-volume pumps, where these filters are placed on the pumps and they can draw the air in over. You can leave them out for a couple of weeks, several weeks, and leave these pumps running and collect dust through these filters. And then we could bring them back to the lab, we could weigh them, we could analyze the content and try to estimate what was there. So here's 3 examples of the filters. And I guess there's a lot of students here, so this is a pop quiz for you 2 of these filters are from mining communities and one's from a control. So we started to do this with scientists from the USGS and WVU, collecting air, water, soil samples collected from people's homes. We were out there doing some collection one day, and we noticed that there were apple trees in the region, and all of them looked strange. They didn't look right. So we collected some apples. You can see a photograph of them here. And you can look at that and you think, well, maybe it's some sort of a mold or a fungus or something. It's not. It's some sort of an oily residue almost, but you can't wipe it off. It's like embedded into the skin. It was really unusual. We didn't know what it was. The USGS people didn't know what it was. But we took some of these apples back to, or they did, they took them back to their lab in Reston, Virginia, and started to do some analyses. And the first test that they do is kind of a quick screening test to test whether or not there might be something toxic there. And so they exposed the apples to some cell cultures, and it was toxic. Whatever is in there was killing cells. And then they were not able to continue at work. So I'm going to come back to that when we get to part 3 on political implications. More of these filters. Here's a field blank, never used. 1 from a control, non-mining community, 4 from mining communities. Obvious visual differences. Significant differences in PM estimates. And then when we were looking at what they contained, there were some analyses that were done to look at both inorganic and organic constituents that were present. And there was a lot of speculation at first about what you might find. What is this dust? What does it contain? And there was concerns, for example, that maybe it's high in heavy metals. We didn't find that. We don't really see a lot of heavy metals in these samples, in either the water or the air samples. But in retrospect, it makes sense. It's high in silica, sulfur, other elements like aluminum, iron, titanium that are suggestive of the overburden, of what's above the coal seams that's removed during the coal mining process. And in retrospect, it makes sense that these are the kinds of things that we would see if the dust is coming from those mining sites. We also did analyses of organics that have identified higher levels of PAHs in the MTR area. Some of them are probably coming from the coal itself that represent uncombusted sources. Some of them may be coming from diesel-related products too. There's a lot of use of diesel in these sites and equipment and explosives. So it seems to be some complicated combination of these different types of chemicals that are present. In addition to looking at the, I'm going to need to hurry up now. In addition to looking at the chemical composition, we looked at the size distributions. Thinking in advance, maybe we'll see more heavy disparity in coarse materials, in like PM10, for example. And we did see higher levels of PM10 in the mining versus the non-mining communities. But it wasn't at a level that would really like jump out at you and seem like, wow, surprisingly higher. But what we did see that we didn't expect were higher ultrafine counts. And ultrafines, as you may know, are the really, really, really tiny particles, like less than 1/10 of a micron in size. And these particles are small enough to be inhaled deeply into the lungs. They're small enough sometimes to even pass through the lungs into the vasculature. Not a lot of research in the US yet on the effects of ultrafines. There are no federal standards for what ultrafine levels should be. There's some more work in Europe that's been done to look at them more closely. But as we learn more about these, not just in respect to coal, but just air quality research in general, the ultrafines are being increasingly recognized as an important potential source for human health concerns because of their small size and their ability to be inhaled so deeply. And the fact that to the extent that they are so tiny, almost everything on it is surface. And so if it is toxic, then it's going to come into contact more with biological tissue. So we found that there were elevations in the counts, including estimates of the deposited counts that you would expect deposited in the human lung in the mountaintop mining community versus the controls. Examinations of PAH levels, I mentioned that they were higher. Here's an example of one of those findings showing total PAH levels in the mountaintop mining sites versus the control sites. The types, a partial list of the types that we've seen that are elevated are shown here on the right. In addition to the low volume samplers, the USGS people put out high volume samplers. These are those big noisy vacuum pumps that work for 24 hours and collect large quantities of air. You can bring them back and analyze them for organics, inorganics. And this is one of the findings here showing primarily the alkylated low molecular weight compounds, indicating that most of the higher levels that they were seeing were coming from the coal itself, probably, rather than from coal combustion sources. So I showed that already. Oh, I'm going the wrong way. That's why. They did also, in addition to the high vols, they did window wipe samples, similar patterns, similar conclusions. They also did garden dust samples. I guess I don't have a picture of that, but similar organics in people's garden soil. You'd like to be able to recommend for people that live in these communities, sometimes low-income people, poor access to fresh produce. It'd be great to say, have a garden. And I feel like I know people who stopped growing gardens because they're worried about the soil contamination in the area. It's hard to say you can recommend it. Some of the dust that was collected from these communities was brought back to labs for analyses and lab studies. This one was published in Microcirculation, and it was a study with rats showing that rats that had inhaled or instilled a dose of the MTR dust showed impaired vascular function. This is what a normal blood vessel is supposed to do in response to increases in pressure, and this is what the blood vessels do after exposure. They don't have that capacity to expand or contract with pressure, which over time, if you think about the extension of this, could implicate things like high blood pressure, could implicate things like the poor distribution of nutrients to tissue throughout the body. This is obviously going backwards now. I'm going to have to do this one. A second lab study, similar kind of a rat study, looking at this time at cardiac function and showing decreases in cardiac function after exposure to the dust. One of the things that's the most exciting thing about this paper for me is that I'm not a co-author on it. And there were some other people at WVU who had taken this on and gone beyond the work that I started. I'm pretty gratified about that. I'd like to see that. And finally, the third lab study that's been published so far. This, to me, is also one of the most important ones that we've done. It wasn't done with rats. It was done by exposing the dust to human lung cultures, lung cell cultures, and indicating that the human lung cells that were exposed to the mountaintop mining dust evidenced a number of cellular changes that are indicative of the progression and development of lung cancer. That was not present in the control material. So we did a small study trying to get some more biological measures. This is the only one so far that we have where we've collected direct biological measures from people that live in these communities. The other ones have been self-report data. Small pilot study, but we took a little fingerstick blood sample and measured it for C-reactive protein, which is a common measure of inflammation. High levels of CRP, above 3 milligrams per liter, are recognized to indicate a risk of possible disease. We found an average in our sample of over 5.4, adjusting for some other variables, compared to less than 1 in the control group. Everybody's a non-smoker, a non-miner in this little study. I'm going to have to hurry. Public water uncertainties, greater number of water quality violations in public, not the people's groundwater, but public water quality tests that are done, and primarily because they were not, it's not that we found so much that there was a disparity in higher contaminants, but we found for the most part that the facilities and the mining communities were not conducting the samples in the first place that they were supposed to for organic compounds. Maybe it's a resource limitation problem, I don't know why. But if you estimate based on filling in the missing data, you still come up with an estimate of health-based violations that are several times higher in the mining community. Water conductivity, this was done from the USGS. The EPA had tried to establish that there should be a maximum of 300 to 500 microsiemens per centimeter of conductivity in water samples. With the USGS, we did some of our own sampling, found levels that were routinely higher than that, including in mountain streams that are supposed to be at that level, an average in mountain streams of over 1,200, and in some drinking water samples above 500. Boy, I'm running out of time. I'm going to skip that one. So the EPA tried to issue I'm going to move on to phase 3 now, really fast, looking at some of the political implications or results. The EPA had tried to establish a guidance that included this conductivity standard to try to set some more careful limits on permitting for coal mining. It was struck down by a federal judge, and I think the ruling is still under appeal, but I'm not really totally sure what the legal status of it is right now. But the EPA was able to deny one permit to a large mine in West Virginia, the Spruce Mine, that was challenged in court but ultimately upheld. So that permit is denied. There's an act that's been introduced in Congress called the AIC Act. That's an attempt to try to place at least a temporary moratorium on mountaintop removal. Has a number of co-sponsors. They're all Democrats. They won't pass unless it gets bipartisan support, and so it seems unlikely to me. But it's there, and who knows? Maybe it will generate some traction. It's been reintroduced now for several years. There's efforts underway to place a ban on mountaintop removal in Tennessee that may be successful based on protecting portions of the Cumberland Mountain that have more natural resource and tourist value that may come through. I'm going to skip. Oh gosh, I'm just out of time. So this one is fun to. I have just a long bunch of stories about this one. This is a press release that took place back in 2010, where we met at the time with Governor Manchin. He's now Senator Manchin, and Congresswoman Capito, who's now Senator Capito, and they promised to look at this issue. They listened to me and to other people who live in the communities and other scientists, and they promised to take a fair and balanced look at this issue, and then promptly ignored us from then on out. The USGS research was stopped. That's why they could analyze the apples and not continue it. That's why they could start to come out with some early posters but not write the papers in the journals. They went and spent 2 or 3 years collecting samples in the field, spending a lot of time and money to do that. And then they were told by their supervisor to stop. I think it was politically motivated. I can't prove it, but that's what I think. A response from the coal industry has been to start this Ares group at Virginia Tech University. They've spent $15 million on it, not just because of our work, partly I think because of our work, but partly some of the work on water quality as well, that they're trying to counter it. The studies that I've seen so far that have come out of the Ares group are laughably bad. And I could go on about that too, but I'm out of time. Wall Street has been cutting lending to coal. I don't have any delusions that it's because of me. It's more of an economic decision, but a number of large banks have stopped funding it. A number of coal companies have gone into bankruptcy. Lots of reasons why this has happened. Coal in the region is clearly in decline. The levels of mining are way down. There's got to be some efforts to build alternative economies for these areas, and I don't see it yet in a serious way. Activism that's been prompted by this. Again, I think a lot of this probably would have happened anyway, even if we didn't have the health research, but it's been used in activist efforts to try to promote awareness of this issue. Very long list, incomplete, of people that have helped me in one capacity or another. And I started to make this list, and I realized how much longer it was getting, and I'm worried that I'm leaving people out, and I know I am. But it includes some of the co-authors I've worked with and some of the local people who have helped out. And so I'll try to answer questions if you have any about what we're going to try to do next or what comes next, or answer other kinds of questions you may have. I appreciate your listening. Thank you.
questions? Just raise your hand. So have you presented any of these results back to the community, and if so, what are their reactions?
I presented it back, not in the sense of like going to community forums and things like that, but I've tried to provide copies of the papers to people and talk to them about it if they're interested, primarily to some of the environmental groups in the area that are working, who have asked for copies, and I'll give them copies of the papers. I've talked to many journalists about it, and so there's been feedback in that sense, but as far as like the type of direct community forum talk you're talking about, that is probably a shortcoming in what we've done, that we haven't done that as much as maybe we ideally should.
So in a state that seems to be increasingly red, and Bevan appointing the old coal exec as energy, and it being not economically viable to keep doing coal, how do you think that's going to go? I mean, is he or she, I'm not as familiar with who it is, kind of new to the state, but what direction will it go politically here if it's not economically viable if they're so big on business?
That's an excellent question as far as I'm concerned. It's surprising to me, frankly, the political and economic power that the coal industry still has in the region, because it doesn't produce the jobs that it used to. It's clearly in decline if you just look at the production figures. And yet it seems to be the case that politicians will still fall over each other to argue who's more pro-coal. And that still seems to influence voters. I'm concerned about it, really, because I see that to the extent that mining in the region continues to decline, and I believe it will, for a number of reasons, that for example, in West Virginia, I know West Virginia may be better than Kentucky, but we have the coal severance tax there, and the state really depends on that revenue, and it's going down. And there doesn't seem to be any serious effort yet in place to figure out what comes next. I mean, if you look at the history of Westerners, Europeans, white people mostly, moving into these communities and establishing economies over the whole Appalachian region, some of the regions have coal, some don't. They're hilly, they're forested, they're rural. The places that didn't have coal developed other ways for people to make a living. There's a variety of other choices that have been developed. And if you just look at the data, it's clear that the areas that, and it's a dose-response effect too, based on not just the presence or absence of coal, but the level of the mining, that the areas that have the heaviest mining have the highest unemployment rates, the highest poverty rates, the lowest income levels. The other areas that didn't have coal developed better alternatives. There are alternatives that can be developed to generate better economies for this region. It might be business development in other ways, it might be small-scale agriculture, it might be sustainable logging, it might be tourism, it might be technology development. There are other things that can be done. I don't see it yet, so I have the same question you do.
I wonder if you could tell us a little bit about the reception you get in communities when you go out to collect this data, particularly the air quality monitors?
The reception, we get pretty good acceptance of it. In my experience, there can be maybe two camps. Maybe there's some people that are really concerned about the issue and they want to try to help out, and they're happy to have samples taken in their yards or where they live. There might be some other people that are more resistant. Usually if they're resistant, it's because they have more of a direct economic tie to the industry, and they may be concerned about that. But for the most part, we've been I wouldn't say welcomed, but we've been at least accepted, and we've been able to do the work that we want to do in an effective way.
So you said you didn't find any heavy metals in the analyzed soil samples. Is that research limited to specific areas in West Virginia, or would you say that applies in Appalachia?
I don't know. The air quality sampling that we've done has been limited to West Virginia. Whether that would be true, I mean, it seems reasonable that it may be true in other parts of the region, but I couldn't say for sure. We've done the sampling primarily in places like Raleigh County, Boone County, Wyoming County. Mostly those areas are where we've done the air sampling.
You just called the studies from the Aries project laughably bad. You're calling your peers in many medical schools, universities, from Johns Hopkins, George Washington.
I don't care where they're from. I'm looking at what they've done.
Yeah, I think they're looking at what you've done too.
That's fine. They can go ahead and do that.
Yeah.
Looks like we might have time for one more question.
In lots of the plots and graphs that you put up, you're looking a lot at physical health outcomes, and you had one slide about depression. I'm curious if you looked at any other neurological, cognitive, or mental health or behavioral outcomes for adults or children.
The only thing that comes to mind, and it's a kind of an indirect indicator, is that we did an older study with secondary data that looked at academic performance for children as a potential indicator of cognitive development. And we found that children who lived in the mining communities were more likely to fail the standardized tests. I didn't report that study, but the standardized tests in West Virginia for the No Child Left Behind policies. Again, trying to control as best we could for other factors. What causes that, it's hard to say, but we did notice that difference.
We'll close it out with Terry.
I was just wondering, with the, for instance, the birth percentage that you saw and a number of your studies for public health outcomes that you took into account. Sounds like you did smoking and all the typical ones, but drug use in the area, because there is a high drug use rate in the Appalachian region.
Yeah, we don't typically have data on drug use. We do have data on alcohol use that we've used when we've had it available to control for that. But we haven't, like illicit drug use, like prescription drug abuse, we have not been able to look at that.
And I would say that's important to temporal trends too, because the approval of OxyContin is also right where the mountaintop removal began.
Is that right? Okay, thank you. Thank you.